it's been 20 years, we are going to give you a little bit of a history of Savannah, Ohio. And so I'm going to ask Johnathon Ross to come up and do that.
I said I would do this in 15 minutes, and you all know me. That was a lot. But I will do my best. So you want to go ahead and put in the PowerPoint? And, I will talk very fast, and maybe it'll happen. All right, so next slide. We'll go.
Here's your clicker.
Oh, the clicker. Wonderful. This is a little story.
100 years of history in 15 minutes.
Yeah, well, I don't even have the technology down, so I'm going to make you advance the slides. So, there he is. That's Teddy Roosevelt. He was the first presidential candidate to ask for universal health care in America. He did it in 1912. It was old News Party time. And he'd already been president and seen a working healthcare system in Germany. And he came back and said, well, we should study this and do something with it. But the truth is that nothing German was going anywhere as of 1914 because of World War I. Next one, Tony, down, please, or I can come over and punch you. This is a booklet called the Committee, what is it again? The Committee on the Costs of Medical Care. This is a Hoover Commission. Prices were already going up. We now had hospitals with sterile operating rooms. We had a whole bunch of soldiers and sailors who'd been in World War I, had scientific medicine for the first time, doctors for the first time were being trained in universities. We had labs, we had X-ray that were beginning to develop, and costs were going up, and they wanted to know why. Well, they looked. This is like a 6-volume report, right? I have to admit I've never read it, but here's the take-home message. The basic problem in medical care was not the system, but the lack of a system to organize affordable care. That was 1932, I think, when they brought up the report. Couldn't do anything with it. It was the Depression. So,
And he was a Republican.
he was, but I don't think he was hoping to get that. This guy wasn't. He wanted to do national health insurance as well, but AMA told him that if he tried, it would destroy the entire New Deal. So it was opposed very strongly. He dropped health insurance from the New Deal, and on it went. Next guy, thank you, is Robert Wagner. He's a senator in New York. He was the first one to write up a national bill, the Wagner Health Bill. And pretty soon that became the Wagner-Murray-Dingle Bill when a couple of House of Reps people came on board. And it was there in 1939, and so we already had a national bill in place. Next one, go ahead. But then we had World War II. And this is a good picture because why is she wearing the bandana and making a muscle? It's because we had a shortage of labor at that time. And there were wage and price controls put in place in America. And you couldn't get people wage increases, so what happened was you had to get benefit increases to compete as a corporation, and they needed workers. So women were in the workforce, but it was more about the shortage of labor that we were dealing with. And we ended up with benefits being hooked to our job. And that's the accident of history where we ended up with our jobs being the source of our health benefits. But that was only for working people. So the next slide, okay, thank you. So this guy took the Wagner-Murray-Dingle bill, this is Harry Truman, and he tried to pass it twice. And both times was stymied by the same forces, the corporate entities, Chamber of Commerce, and the AMA. But he made valiant tries twice during his term of presidency. Why don't you go to the next one? That's fine. Thank you. And is Barb in here? Barb Walden? She's out there. I'm sad. Barb Walden was in the Bakers Union. She's one of our oldest. She's like a matriarch of STAN. She's been an activist for her entire life. She actually, I think, one time was an officer in AFL. So Barb was a baker. This is the Bakers Union marching in Detroit on Labor Day. But, so the peak of the labor movement was probably the 50s and 60s. And so lots of working people now had health insurance through their jobs because they had done a good job bargaining for it and getting it. But unfortunately, that wasn't going to be enough for old people and the poor. Because old people were going to get sick and the insurers really weren't too happy to see them coming, and most of them didn't have a lot of money, so they were going to, and the poor, of course, had no money, so they don't need to do it at all. So there was a big fight in the 1960s about, first there was a Nixon-Kennedy debate about it, whether we should have a health insurance program for the elderly. And the AMA hired this B-movie actor, star of Bedtime for Bonzo, And he made a record that the AMA sponsored, and the wives of the doctors were supposed to play in the coffee clashes. And it's all about how that this was the road to hell, the road to socialism if we did Medicare. We're going to spend our sunset years telling our children and our children's children what it was once like in America when men were free. He doesn't say anything about women or people of color, but anyway, he was wrong then, he's wrong now. We've had Medicare for 60 years now. It's one of the most successful social programs. It didn't make us into socialists. So he was wrong, and also when he was president most of the time. This is LBJ. LBJ was a brilliant politician. He'd been a senator, he'd been a rep, a House of Reps member. He knew the dirt on everybody, and he also understood that the second most powerful people in Washington, D.C. are committee chairs. And so what he did is, when he tried to get Medicare passed, he went to those committee chairs and said, you need to work with me at this time. Wilbur Mills was the main one. It's a wonderful history on the CMS site. If you go to the Medicare site and look at the history, you can look it up online. It's a little bit of a read, but it's a lot of fun. I mean, it was really a very interesting time. And the reason anybody who's here who has traditional Medicare with a supplement, the reason you need a supplement, AMA. They said they wanted 80-20. You had the other 20%, otherwise old codgers would use too much health care, right? Who here has had fun going to the doctor? I mean, it's just a ridiculous argument. But the bottom line of it is they had to put it in there to get it done. And this is LBJ signing Medicare. And nobody cared about Medicaid, by the way. That's poor people. Nobody paid much attention. If you look at the Medicaid benefit package, it would be a great national health insurance benefit package. It's very comprehensive. But the bottom line on it doesn't pay, so everybody pretends like it's bad. But that's Harry and his wife, and Lady Bird, and Lyndon, and Hubert Humphrey, all up there at WJ signing the bill for Medicare. So next one. It's longer than a minute to do. Hey, here's a friend. So before he almost went to jail, he needed something to oppose what he thought would be a national health insurance program from Ted Kennedy. And so he needed something. So he got a friend of his, a guy named Paul Elwood, who was in a staff model HMO in Minnesota, and was talking to the staff model people, and they said, well, you know, we can do healthcare for less, basically with a micro national health service, right? Or the VA-like thing where docs are hired and the hospitals are owned. And he said, oh, that's funny, that's great. We'll make everybody do it. So these guys that don't like mandate, they passed a law mandating that businesses with more than 500 people had to offer an HMO to their employees. And they inserted HMOs into Medicare at that time. And now we've got the whole mess with Medicare Advantage ripping us off by tens of billions of dollars a year. And we've got now DCEs with Wall Street taking over traditional Medicare. So thank you, Richard Nixon. These guys. So in 1989, there was something called the Pepper Commission, which again was looking at how to get everybody covered. And soon after that, an obscure history professor from Pennsylvania, from Haverford, named Harris Wofford, ran for Senate against a two-time sitting Republican senator. So that guy'd been there for 12 years in Pennsylvania. And he beat him, running on national health insurance. Now, this man, and nothing else, he was smart. And he saw a horse he could ride. And he went ahead and ran his campaign. One of his key planks was he was going to do health care for all. And so we all showed up. Next one, please. Thank you. We all showed up in Little Rock. Was anybody in Little Rock besides me? Nobody went. I took a bus. We went from Cleveland, we picked up people in Columbus, and went down to Little Rock, Arkansas. So think about that as a bus trip first. It was a lot of fun. But I'll tell you something, I'm diverting again, making this too long. I met a guy from the UE, the Electricians Union, on that bus. He'd been working for National Health Insurance since he was 18 years old, working in the rural electrification program, which was part of the New Deal. And it made me realize that this is a lifetime that we're going to need to work. And even if we win, and we will win, we're going to have to continue to work because they'll try to take back. They'll try to privatize it again. We can see that. They're doing it in Canada. So anyway, this is the march. What happened was the disabilities people were angry Clinton would come and talk to them. So we were in the biggest room in Little Rock. It was a ballroom at a Holiday Inn. They went out the door, up the street, spontaneous march, down to the Capitol building. It was a teeny little place, actually, where Clinton was inaugurating Billy Bob somebody or other who went to jail later on. And we stood around Kumbaya until they came out and shook our hands. And every one of us in that line was saying, come on, you can do a single payer, we can do Medicare for all. No, we got a big old ugly complicated plan. Go ahead, Deb. And despite having a great bill from the McDermott-Wellstone bill that we could offer, we didn't get hearings, we didn't get listened to. We got one meeting with Hillary's group, with our PNHP leadership, and that was what we got as an entire input into the Clinton campaign. Now, Clinton was not a smart politician in that he was a rookie, and he didn't involve the committee chairs. And so nobody had any vested interest in his bill working, and when it came out and was a flop, and all the powers that be were against it, it didn't even ever come to a vote. And he did get some incremental stuff. He managed to get the Children's Health Insurance Program passed in the second term, and that's not small stuff. It was worth doing. But so then this is where we come in. After the Clinton debacle, things really fell apart. I mean, during the Clinton era, the whole single-payer movement pretty much unwound. I think Paul Wellstone was killed in an airplane crash. That didn't help us. We didn't have a real instrumental leader the way we have Bernie Sanders now. And so it really devolved into, can we keep what we have? You know, we're into the Reagan years, can we even keep Medicare and Medicaid intact? And so we had kind of a split. We had our national UCAN, which was a single payer organization. I got the sign to prove it. And they became more of a, God, we got to protect Medicaid, we got to expand whatever we can do to expand, we'll support whatever incremental stuff we can do, versus the single payer people who are still fighting for a system that would be comprehensive for everybody. And so when the Clinton thing fell apart, some people in Cleveland created Spookock. And pretty quickly they decided that Spookock was it was catchy. It was what could you catch? Was the bigger question. Anyway, so the people in Cleveland did that for us. The single payer advocates. There's a guy named Jared Gordon, who was a labor lawyer, who was really aggressive. A good guy. But the bottom line on it is we ended up with Span, Ohio. We were organized, and our speaker for the afternoon, Claudia Fagan, wave Claudia. She's Dr. Claudia Fagan, one of the founders of Physicians for National Health Program. I asked her if she would come and speak at our first meeting, and she did. And that was in Cleveland. I think it was at Case Western, in a building like across the street from the medical school, if I remember right. But anyway, she was one of our first speakers. She's going to address this 20 years later again. And so, and nationally, we evolved into a couple of different things that eventually came together as Healthcare Now, which is kind of a conglomeration. It's a network group for single payer across the nation, which, by the way, there was a single payer across the nation, so we stole our name stand from the organization Single Payer Across the Nation, which kind of eventually evolved into Healthcare Now. So next, thanks, that was too long. This is us. I'm going to go through it really quick. Claudia comes. We have a resolution campaign asking our state legislators to, without delay, put a program in place for healthcare for all Ohioans. And so we went around talking to the unions, to churches, saying, please sign the resolution. So we have this sort of resolution campaign, a little bit like what Citizen Action is doing now, right? It's the Citizen, no, Public Citizen. And then we decided that we need a bill. We had a bill, actually, in 1990 called the Ohio Bill, which was put in place by Bob Hagan. I think some of the Clevelanders were involved in all that again. Never really got anything going with it, but we decided we would write a bill, so we did. We got involved with the proper people who could help us get it into legislative language. And then there was a huge debate. This is probably one of the biggest debates we ever had in Span, which was, should we try to do an initiative petition to pass healthcare for all of Ohio? And we recognized that we were small, that it would be very difficult. We had to collect 140,000 signatures, and then if we did that and turned it in, and they didn't act within 6 months, I think, the State House had to act. If they didn't, then we had to collect another 140,000 signatures just to get it on the ballot. And we managed over about 5 years to collect over 100,000. I actually have a petition here if anybody wants to see it, because I forgot to turn one in with about 10 names, so 100,010, I guess. And so we got, the unions were helping us in this, and we got a good number of people signed on, but it looked like we were not really gaining energy. We rallied, we had a big rally in Columbus. Unite brought in buses of people, we chanted, so we had that sort of energy from the union movement at that time. Dave Pavlik, who was representative of the UAW, is Dave here? No, Dave Pavlik. Dave Pavlik decided that he was going to walk across the state of Ohio for single payer. And amazingly, he did. And he talked me into walking with him from Fremont to Toledo, and I've never been right since. I never want to do that walk again. In the middle of the summer, too. He did the whole state in the middle of summer. Anyway, we were having some debates with the remnant of UCAN, which here in the state was UCAN, Ohio. Our two executive directors were constantly dueling. They were trying to get a big chunk of money from the Robert Wood Johnson's Foundation. They wanted us to support them, but it didn't say anything about, comprehensive reform. They just wanted to organize consumer voices for care. And so we had a big fight over it. Eventually, we settled that fight by agreeing that we would adhere to the Institute of Medicine's Principles for Reform. If you go and read those, they're old now. The Institute of Medicine's even changed its name. But those principles for reform, there's only one system that you can say will fit that. And it's the single-payer, expanded, improved Medicare for all. But, so they were in agreement that we would agree on principles, and we stopped fighting. And we went back to fighting for single payer again in 2008. What happened in 2008? Well, that was the Obama-Clinton debates. And Clinton, was probably, she'd shown what she wanted to do. Some sort of payer play, big HMO, big insurance company dominated process. And we had Obama, who had said he was a single payer advocate, right? At one time in Illinois when he was a legislator there. And he even said out loud, hey, if we're starting over, I'd do a single payer. So we were really hopeful when he won the election. So we were hoping we would get something really worthwhile. Now, Obama's a smart man too, and he said, I'm going to give you committee chairs a chance to come up with some healthcare legislation. I'm willing to spend, or ask the country to spend, an additional $100 billion to cover people. And you bring me a plan. If you don't bring me a plan, I'll bring you one. And so they went to work, and of course, we had the usual sort of, you don't want to see laws made or sausages sort of thing happen. And again, we wanted to speak to single payer. We had a strong movement again. We were showing up. I think we showed up in D.C. again in 2009. I think you were at that one, right, Ted? So we went to D.C. by bus and wanted single payer, but they weren't going to talk to us about it. And we had a bunch of advocates arrested in the Senate Finance Committee meeting with Max Baucus. So we never got to the point where people were considering or giving decent hearings to single payer. And then the ACA eventually passed, almost by a miracle, because Ted Kennedy died. We didn't have the votes in the Senate, but they managed to do some shenanigans with the vote, and they got it passed without a single Republican vote. Now, I don't want to rub this guy too hard because, in all honesty, 20 million people more got some coverage, especially the Medicaid coverage, which is pretty good, even if it doesn't pay doctors very well. It's good coverage for people if they can stay on it. And again, you have all the complexity of managed care having nosed its way into Medicaid, and all the complexity of that, and being assigned rather than choosing, and all the rest of it. But it was a reasonable chunk of incremental reform, except that it really solidified the insurance industry in the heart of reform. So now we were once again offering more private insurance, and making them still dependent on what is a very faulty product. Next one. These guys are our current heroes. We got Bernie, Permilla's, I think I'll ask an expert here. Claudius, Permilla's the best bill ever. I think it is. It's our best iteration ever.
It's the most comprehensive.
It is a wonderful bill. Go and read it if you really want to understand what we're trying to do. And so we're still in the fight. Why? Because guess what? We're getting hearings, national hearings. And next slide, I'll carry on with the Stan story. We've enhanced our lobbying efforts, thank you, Dee Chavez, and Mary Nichols Rhodes. She's not here, is she? Is she here? Mary's in there? But they've been putting together our lobbies. Every time we've introduced our state-based bill for every 2 years, we've done some sort of educational opportunities for the legislators and legislative aides. So we are really, we're recognized in the state capitol now. They know when that bill's introduced, we're going to show up. We lined Route 42. We have a doctor, I don't know if she's here. She's not. We had a doctor who said, let's line Route 42 between Mansfield and Columbus with signs. And we tried that for a while and asked people to honk for single payer. And we've committed to fundraising like we've never committed before. And I'm gonna, you know what I'll do to you later, right? All you poor suckers who showed up today, I'll be asking you for more money. But anyway, we learned, then COVID landed and we learned how to use Zoom. It wasn't such a bad thing. You know, we really were able to do some new things that we've not done before. We could create conferences that we could share. And so I think that we got, you know, learning to Zoom was a good thing. And we created some really good webinars. Our active committees, as Deb pointed out, are really getting to work, and it's making, thank you, Deb, because it's making us a much better organization to have delegated that work, and I think it builds commitment from people in the organization. When they're working in a committee, they're more committed to the organization. So, we're celebrating 20 years. Happy birthday, Stan. I took way more than my time, but I have lots of historical trash I brought with me because I dug through stuff, and I understand that Rachel DeGolia has been making it possible to get the old UCAN stuff online now. So you can really research this stuff and look at a lot of the history if you care about it, like I do. So thank you very much.
Thank you, John.